Hello, I'm Jeff Petersen. I'm a physical therapist. I have been for 40 years, and we're in the middle of our series on joint protection. So I'd encourage you to go back and look at the previous segments on just general principles. Also look at some of the videos we've done on pain and ergonomics, because that's really important. Today we're going to talk about the rest of the lower quarter, which is the knee and the ankle. This is helpful, please. Send us your favorite emoji, give me a heart. I always love getting the love hearts. Send me some love, comment on it, ask questions, whatever you need. I'm just going to go over briefly some principles of how to protect normal joints. This does not include pathological joints, and I mentioned before there's a continuum we work on in terms of the optimum amount of mobility for a joint. If I have a knee joint and I blow out my ACL, the ACL attaches to the medial side, the inside of the tibia and the inside of this lateral condyle. And if I rupture that ACL, that's a pathological condition that requires surgery. But before it becomes a pathological condition, there can be some hypermobility. Now, this knee does not show an important part of the knee, which we often see as causing pain in the knee, and that's the patella. So, for the sake of demonstration, what happens is the quadriceps muscle attached to the thigh here, and then they attach to the top of the kneecap. The kneecap glides in this groove. You can see how this one is a little higher than the other. So it glides in the groove. Sometimes when you have the big lateral quads, they can start to pull that kneecap out to the outside and it becomes irritated. That is a common area of pain and dysfunction in the knee from overuse. So how to protect that? One, be conscious of the activities that you're doing. The forces that are applied to the patella are typically compressive forces. So keeping flexible hamstrings, strong hamstrings, and particularly strong glutes. So our glutes attach here, then they attach to a long tendon that come down to the outside of the knee. Keeping really strong glutes, flexible hamstrings, and active and strong quads are one way to protect the patella. Other ways are, watch your activities of daily living. If you're a gardener, if you're a woodworker, just doing stuff around the house and you're kneeling for any amount of time, and if you're over 8, you should be wearing knee pads when you're kneeling to protect that patella. So kneeling is one of the activities that can really irritate the patella. The other thing is a certain amount of exercise. If you're going into the gym and you're starting to exercise, the biggest mistake people make, the 3 principles of exercise: frequency, duration, and intensity. The frequency is how often you work out, the duration is how long, the intensity is how hard, how much force you're applying. Typically people work out with too high of intensity. So the key is when you're just starting, you want to go consistently, you want to work your quads, you want to work your glutes, be careful with some of the activities that you find painful, and making sure that you're not doing a lot of kneeling. So if you have a hypermobile patella, it can create a lot of pain. The other thing that is really difficult on knees is the compressive forces. So we see people doing this all the time, jumping off the back of the truck. I had to stop doing that several years ago. You jump off a truck and you get compressive forces on the knee. Hiking, if you're hiking out in the desert and you're jumping off a boulder or you're climbing up too high of a boulder, that can create some challenges for the knee. Obviously sports and activities like that can irritate the knee. So part of what I say is participate at the level that you know you're prepared for. Around the holidays, it's not uncommon for people to get involved in touch football games, get involved in games in the yard when it's nice out here in Arizona. You need to be careful. Back east where I come from, the idea is you got to be careful slipping on the ice and snow. Make sure your feet are under you. So the compressive forces are important, particularly when you're jumping and running. Also the compressive force on the knee if you're kneeling, when you're gardening, when you're pulling weeds, when you're doing woodwork, anything around the house. You want to make sure that you get a good quality pair of knee pads to protect that knee. As far as the ankle is concerned, the ankle and the foot are really complex. When we talk about the ankle, we talk about this talus as it sits in the mortise. So that's the ankle proper. Then you've got the calcaneus underneath it. Then you've got the forefoot and the toes. One of the most important things to protect your foot and ankle is making sure you have proper footwear. Making sure that you have a wide enough toe box that it's not crunching your toes. Making sure that the footwear is stable in the hind foot to keep that ankle nice and stable. So that's the most important thing you can do for your ankle. The other thing is to make sure that when you're sleeping, that your toes aren't constantly forced into what we call plantar flexion, so those calves get tight. So making sure that you keep your calves nice and flexible so that you can pull your foot up towards your head. You'd be shocked at how many people are really tight in there. So you want to make sure you keep good, flexible, strong calf muscles. You want to make sure that when you're sleeping at night that you're not in full dorsiflexion. And you want to make sure you have a good, stable pair of shoes to wear when you're out walking. My philosophy is I don't want to wear a pair of shoes I wouldn't walk at least a mile in. If it gets uncomfortable after about 15 minutes of walking, then that's not a comfortable pair. That's not a safe pair of shoes no matter how good they look. So it really is important. The other thing is it's important to change your shoes out like you do your tires. Every so often the shoes will start to wear out. As they start to lose their support, you need to get a new pair, just like you would your tires. When I first started practicing 40 years ago, it was an old man who once said to me, I was a patient, probably the second or third patient I ever treated, and I was bragging about getting a good deal on a pair of shoes. And he said, don't ever skimp on your shoes or your bed, because if you're not in bed sleeping, you're up walking around. And I'll never forget that wisdom, and I've incorporated that in my life. So you want to make sure you have a good, stable pair of shoes, they fit properly, and you want to make sure that when you're sleeping, your foot isn't in complete plantar flexion. Obviously, there are pathological issues that can go on in the foot, and those need to be addressed separately, but that's probably the most important thing you can do to protect your ankle. So that summarizes how to protect your lower quadrant. It's about recognizing the forces that you place on your lower limbs and your back every day and being aware of it, not just being ignorant of what you're doing. So you want to make sure you intervene in your activities before you have pain. You'll start to feel fatigue in your back if you're arching too much, or fatigue and discomfort in your feet if your shoes don't fit properly, or discomfort and maybe a little fatigue in your patella area if you're kneeling too much. Those are the cues to make changes before there are physiological changes to the joint surfaces that it almost becomes too late. So I hope this is helpful. Feel free to throw me some emojis or some questions, because I always appreciate your feedback.